Class. My names are Oyebanji Bolaji from the Faculty of Health Sciences, studying Healthcare Management / Nursing from Joint Professional Training and Support International Incorporated Institute of Science, Management and Technology, Offa Study Center. I'm here presenting a term paper on the effect of doctor-to-nurse relationship on patient care. Abstract. The purpose of this research was to examine doctor-to-nurse relationship and its effect on patient care in University of Ilorin Teaching Hospital and General Hospital Ilorin. Two null-hypotheses were formulated based on the identified major independent variables, namely medical teamwork and doctor-nurse value orientation. To generate data for testing the hypothesis, a 47-item questionnaire entitled Doctor-to-Nurse Relationship and Patient Care was developed by the researcher and validated by the supervisor. A significant relationship between doctor to nurse should be encouraged for effective healthcare delivery system. Introduction. The interrelationship between doctor and nurses is examined in association with patient care and other health services. This is possible because smooth working relationship between doctor and nurses is essential for efficient delivery of healthcare services. This study examined the form of relationship that exists between doctors and nurses and how nurses are coping with the situation, bearing in mind and differences in status and gender which may affect the status relationship. Nurses were observed to take part in duties that have been the prerogatives of doctors and have become accountable for every patient in their unit. Like doctors, nurses also apply skills of problem solving, observation, diagnosis and treatment through increasing integrated practice using nursing process. Elaborating further, Peter 2012 asserted that collaborative nurse-physician relationships are associated with improved nurse and physician outcomes. OTT 1991 stressed that significant patient outcomes which have been noted include improved patient satisfaction, improved patient care or outcomes, reduced medication errors, decreased job satisfaction, improved job satisfaction and decreased organizational costs, improved efficiency of healthcare workers. Doctors and nurses are two major health workers in the hospital who have continued to attract attention. Nurses are closer than all other health workers. The closeness of doctors and nurses is brought about their frequent contact with patients in the hospital. It is for this reason that the research was carried out to determine if patient care is by any means affected or related to doctor-nurse relationship. The specific doctor-to-nurse relationship considered include medical teamwork and value orientation. 1. Review of related literature. According to Alexander 2012, the popular image of doctors and nurses working together harmoniously is not always matched with reality. Alexander 2012 further stated that ignorance of the profound changes in nursing which has redefined the boundary between nursing and medicine, such that nurses has become autonomous. Medical teamwork and patient care, Gibak and Kozot 2004, stated that the goal of joint practice is to improve healthcare, not to protect or preserve professional prerogatives. 2. Research method. The research method design adopted for this study was the survey research design, conducted at the University of Ilorin Teaching Hospital and General Hospital Ilorin, Kwara State. Hypothesis 1. There is no significant relationship between medical teamwork and patient care. Hypothesis 2. Doctor-nurse value orientation does not significantly relate to patient care. In conclusion, restoring the health of sick people that are brought into the hospital for medical assistance is the primary role of doctors and nurses in any hospital. This study has confirmed that in the studied hospital, the relationship between the doctor and nurses was not too cordial. Based on the research findings of the study, the following recommendations are made. 1. The doctor and nurses should try as much as possible to settle their differences, create a smooth working relationship, and not allow their individual differences affect their work, which is so vital in the services of healthcare delivery. 2. There should be better recommendation for other sectors of the medical institution in order to foster healthy association and collaborative work relationship between them, especially doctors and nurses. Thank you.